Hi, my name is Eric Leaf, and this is my Being the Best Advocate presentation for Imaging Sciences 412. So, what is an advocate? An advocate is someone who helps and assists people with making sure their rights are being fully considered and recognized. An advocate can help someone to come up with solutions about a health problem or any other type of problem in their life. An advocate may be part of a community organization, be part of a volunteer agency, or be a community member wanting to provide help and assistance. So what can an advocate do? An advocate can speak for you and represent your views when you feel unable to do this yourself. An advocate can provide information and guidance. An advocate can prepare written communication or legal submissions. An advocate can attend meetings, hearings, or appointments. An advocate can clarify processes and procedures. An advocate can negotiate, mediate, or otherwise assist in alternative dispute resolution. And an advocate can also gather and organize information and documentation. So what is patient advocacy? Patient advocacy is being a patient advocate means that you are looking out for the patient's rights. This could include their human rights as well as their legal rights. An advocate can speak out against actions or policies that could interfere with the patient's rights or possibly endanger them. An important aspect of advocacy is to inform and support. And some of the steps to being a successful patient advocate are to make sure the patient agrees to receiving the information that you're going to be giving them. Make sure that the patient either have the necessary information or way to get the information. Make sure that the patient actually wants the patient to have the information. Present the information in a way that is meaningful to the patient, and accept the fact that there will be people who do not want or wish the patient to get the information from you. So why is patient advocacy so important? Patient advocacy can help to give the patients their own voice in certain types of situations, and it can give the patient the opportunity to make their own choices in their healthcare decisions. It is important to listen intently to the needs and wishes of patients to ensure that they are being cared for properly and compassionately at all times. It helps to show the patient that you truly care about them as a person and not just as, another patient that is coming through the hospital. It is important to respect the patient and maintain their privacy and autonomy. It is important to a patient advocate helps the patient to understand the options of care and all of the processes that go on in a facility. And an advocate can help to prevent and or manage suffering and difficult situations. And these types of situations, this can mean being an advocate focusing on psychological, emotional, or physical issues. So an example where I displayed some advocacy was one of the best ways that we as imaging professionals can be great patient advocates is to always practice ALARA as well as work off of the image gently and image wisely precautions and procedures. My example doesn't really come from one specific patient or case, but has it is something that I always try to do with every patient, especially with young children. When a provider orders an X-ray exam, I always check their EMR to see when the last time they received an X-ray was. Sometimes the provider will miss the fact that they had an X-ray a day or two prior. And when this occurs, I am sure to always check with the provider to see if the new images are absolutely necessary to get. Sometimes the provider can get upset that I'm questioning their order, but sometimes they're thankful that I checked because a new exam is not always necessary at that time. So we, talk it out and figure out the best plan for that particular patient. So my example isn't necessarily one specific case, but it involves every single patient that comes through my door. And I always try to be the best advocate for them each and every time to be sure that the radiation they're receiving is absolutely necessary. And so some of these are my references that I used for the presentation. And thank you, and I hope you enjoyed the presentation on how to be the best patient advocate.